everyone, so my name is Angie and I'm the nurse behind Nurse Angie J. So today's discussion on behalf of Nurses.co.uk is on all things related to safeguarding, and I kind of wanted to focus on child abuse. I think as professionals it's important to have awareness and recognising the signs and what to look out for in regards to a child or young person who you may come across in your practice, in your areas of work, even out in the public, who you may feel may be at risk. I don't feel like you necessarily have to be a paediatric trained nurse like myself to know or be aware of child abuse, because abuse to children and safeguarding as a whole is everyone's business, literally. You know, you could be an adult trained nurse and work with parents who have children, or a mental health nurse, for example, who works with young teenagers. You can even be a care assistant who's, walking along the corridor and you've seen something in relation to a child and parent kind of interaction and you're not quite happy with what you've seen. How would you deal with that kind of thing? Here in the UK, we have 4 categories of abuse that we deal with, and they are emotional abuse, sexual abuse, physical abuse, and neglect. So let's start with emotional abuse. Emotional abuse can be harder to detect, but it doesn't mean it's not possible. And this is basically any type of abuse that is continual emotional mistreatment of a child or young person. And sometimes it can be called psychological abuse. And this can involve deliberately trying to scare or humiliate a child. You're ignoring them, threatening them and shouting at them in order to call them names, or just making them feel startled and scared deliberately. You're making that child the subject of jokes or using sarcasm to hurt the child. You're making a child perform degrading acts. You're not recognising a child's own sense of individuality, or you're trying to control their lives, Pushing a child too hard or not recognising their own limitations. Exposing a child to upsetting events or situations like domestic abuse or drug taking is also a form of emotional abuse. Not allowing a child to have friends and develop friendship circles is also emotional abuse. What kind of signs would you be looking out for then? So a child might appear unconfident, or they lack self-assurance, and resilience is really an issue for them. They struggle to control their emotions. They have difficulty making or maintaining relationships and friendship circles, and they act in ways that are sort of inappropriate for their age. In babies and young toddlers, for example, they may be overly affectionate to strangers or people that they don't actually really know that well. So, for example, if you've approached a child or young toddler before, at a certain age, they would have a sense of stranger awareness and who's in their life and who isn't. But if you have a young person, a toddler, who is reaching out their arms for cuddling, picking up, they're very overly affectionate, that's a sign of emotional abuse, and maybe they're not getting that emotional warmth from their main caregivers. Children that have extreme outbursts and not able to regulate their emotions is also another one. A child may seem isolated from their parents, not having a very good relationship, So the next one we'll talk about is physical abuse. Now, this is basically when somebody hurts or harms a child or young person on purpose. And that would include things like hitting, and that can be with your hands or with an object. Slapping, punching, kicking, shaking, throwing, poisoning and burning or scalding a child or young person with things like cigarettes, candles, that kind of thing. What would you be looking out for? You'll be looking out for bruising. And when I say bruising, obviously children are not going to be falling over if they're of a certain school age, for example, falling over in the playground, in the park, they bang themselves on their bike handles, scooters. That's absolutely fine. It's in context. And you have to be looking at the consistency and if the explanation matches the story, basically. So, for example, if you've got bruising on a child on the back and it looks like fingertip bruising, then you kind of need to be thinking. And the same goes for like broken or fractured bones as well. So, for example, if you've got a 4-month-old or 5-month-old baby, they're not as mobile, are they? They're not going to be kicking a football around to be fracturing or injuring their bones. So if you have a baby or younger person under an age and they've come in with broken limbs, fractures, you kind of need to be thinking, how did that happen? Same again for burns and scalds, obvious cigarette circular burns, you need to be asking. Bite marks as well is another one. So in babies and toddlers, we need to be looking at things like swelling, bruising, fractures, as I've explained before. If that child is extremely sleepy or unconscious as well, vomiting, seizures, and these could be related to head injuries that they may have received as the terms of like trauma, or being shaken. The next category of child abuse is sexual abuse. So this is when a child or young person is sexually abused. They're either forced or they're tricked into sexual activities. Now, they might not necessarily understand what's happening to them because they've been groomed and coerced over time, to maybe made to feel like it's normal. They'll often be told things like, it's normal, it's between us, don't tell anyone. And, that unfortunately gets imprinted in their head. And you find that these children who have been sexually abused are afraid to speak out because of what they've been told. They may often have been threatened as well. If you tell anyone, I'm going to hurt your mum, or, that kind of thing. So we need to be very delicate and aware when it comes to sexual abuse. And it can happen anywhere, either in person or online. And this will involve sexual touching of any part of a child's body, whether they are clothed or not, using body parts or an object to penetrate a child, forcing a child to take part in any form of sexual activities, and that includes oral sexual activities as well, making a child undress or touch somebody else, exposing or flashing a child, showing a child pornography or sexual videos, sexual pictures is classed as child sexual abuse. Making a child also masturbate is also a form of child sexual abuse. So the kind of signs to be looking out for will be bruising, bleeding, discharge. The child's complaining of pain or soreness in their genital or anal areas. You need to be thinking about why that child is complaining of pain. Any sexually transmitted infections. Now, no child should be getting any STIs, so that's definitely a red flag to be looking at. And I also want to add thrush into that as well. So obviously, children may be susceptible to thrush because of maybe having taken antibiotics, for example. Even as adults, we may get thrush every now and again. But when it's persistent and consistent, along with, for example, bleeding, discharge, pain in the genital or anal area, then we need to start putting 2 and 2 together. Also, signs of sexual abuse is pregnancy. If a child is pregnant, we definitely need to be looking at sexual abuse, especially if that child is under the age of 12, because a child under the age of 12 in this country cannot be consenting to anything. Another big thing is sexualized behavior and play in talk. So if a child, for example, you've noticed around you who's playing with dolls or playing anything, and the way they're playing with the dolls, for example, is very sexual. The way they're talking, the words that they're saying is very sexualized. We need to be thinking as well. The final category of child sexual abuse or child abuse. The final category of child abuse is neglect. And neglect is ongoing failure to meet a child's basic needs. And actually, unfortunately, it's the most common form of abuse that I see in the safeguarding field. So this could be a failure to sort of meet a child's basic needs, such as feeding, food, providing food, clothing, shelter. They're not being met properly or supervised, or a child is not being kept safe. And ensuring that your child is given an education. So if you're quite happy for a child to just stay at home and not go to school, nursery, college, there's an issue there. Withholding nurture and stimulation is a form of emotional neglect. And this could be things like, ignoring them, humiliating them, not providing a stimulating and nurturing environment. There's no toys in the home. Their walls are very bare. There's no colour, stimulation, things that are going to allow a child to be nurtured and develop. And then things like not taking a child purposely to hospital appointments, GP appointments, ignoring medical recommendations, things like not going to the dentist or opticians. Dental decay is a big thing and a big issue here in the UK amongst children, particularly under the age of 5, where, children are having to go in for day case surgery under general anaesthetic to have significant amount of teeth removed down to dental decay. So these are all things to be looking out for. So what would you do if you suspect as a professional or a person out in public, what would you do? So there would be an escalation policy, which I would hopefully you guys are aware of. So your trust, your ward, your department, your workplace should have an escalation policy in regards to how to escalate and report child abuse. And that might be things like filling out a MASH form, contacting social care, and also if the child is in immediate danger, then you need to be calling the police straight away onto the scene. So if you're not aware of the child escalation policy for safeguarding and abuse, make yourself aware of where it is, if it's on your intranet, if it's in a folder in your offices somewhere. Have a quick read through it and just make yourself used to what the policy and process is. So I hope you guys have found that quite useful and quite helpful. Thank you for listening and see you next time.